This is the Zemar Podcast. Elite Benefits of America helps small and mid-sized companies with their health insurance programs. And now, your host, Butch Zemar.
Welcome back to the Zemar Podcast. I have a guest here, William Hammett from Hammett Insurance Services and Hammett Marketing. I think they're one and the same, but I'll have Bill actually give a further introduction for himself and what he's been doing for the last so many years in our industry and how he's making an impact.
Hi, Butch. Thank you for having me on your podcast. I appreciate it. Yeah, as mentioned, I have been doing this for a long time. I think I hate to count, but it's been over 40 years that I've been in this, as we generally define it, employee benefits. But right. In the last 10 or 12 years, I've been very targeted as a general agent, as a broker's broker, if you will, with the producers in our industry, brokers, agents in our industry, who have a need to know more about the Affordable Care Act, for instance, and how some of their clients can comply with the act without, breaking the bank. Because most of them, honestly, frankly, especially in the service industries, the hourly worker industries, had not provided or typically did not provide benefits. Now they're forced to. So they were looking for the most cost-effective way to do so. And we evolved our general agency into being, the go-to experts, the backroom experts for these brokers when they run across those types of employers.
For sure. And there's a lot of things that has happened over the last 10, 12 years with the Affordable Care Act, and then even prior to, right? And so biggest thing is definitely the rising cost of health insurance premiums, right? And so sure. Making things more affordable and the traditional way, and we've talked about this offline, where traditional way is premiums go up, you adjust your deductible, and we're right back to square one again, right? And so some people have to be a little bit more innovative, and you took that approach. And even though you don't work directly with the retail end, so like the employers, you work more with the brokers. But I guess, how is that leveraged? I mean, from your year's experience, how is the agent or broker leveraging that? And then what's your experience working with the broker community on these types of products?
It starts with the premise that most brokers, even big alphabet house brokers, big legacy agencies, don't deal with, hourly workers very often. It's their focus is always on the core group, full-time employees, majority of whom are moderately to highly paid. And historically, group insurance has always aimed itself at, back when I started, it was designed to be what's best for 85-90% of the group. So you would design plans to benefit most employees. As we've evolved forward, as you mentioned, with risk increasing and cost sharing increasing, we've focused more and more over the last 20 years on the 2 or 3% of the employees that might have catastrophic risk or catastrophic illnesses. And we've kind of let the plans move in that direction. So they serve the 5% who have high claims, and another 95% are paying big deductibles and co-insurance, and being pushed further and further away from access to basic care. Mm-hmm. And so what we've tried to do is enhance the awareness of plans that are more first dollar types of programs designed for relatively healthy people who don't spend more than $500 to $2,000 a year in healthcare expenses. That is 95% of most of the groups, and it's kind of gotten lost, I think, and that's what we're trying to bring back into focus. Not just low-wage hourly workers who have not been insured previously, but also we're designing plans that have fairly robust benefits for the relatively healthy. And I think as health insurance evolves, we're going to see more and more of these concierge networks that serve first dollar, kinds of access issues that are ignored by the high deductible, high co-insurance, high cost sharing type of programs.
I want to get a little bit into the engineering side, if you want to call it that. And so obviously these plan designs are a little bit different than traditional health insurance. And me personally, have worked with them in a limited capacity. And so I would like you, if you don't mind, actually walk through some of the differences that people will notice on these plan structures. And I'd rather hear from you because you're dealing with these products on a regular basis.
Okay. Well, first of all, let me say, you and I have talked about this offline,
Yep.
but these plans are not designed as replacements for traditional major medical plans. That's number one. But traditional major medical doesn't serve all the population very well anymore.
Mm-hmm.
In particularly those groups I was discussing. So the differences, in a nutshell, are the so-called MEC or MEC Plus or limited benefit type plans eliminate all the high catastrophic coverages. So if you had typically, if you have a serious, dread disease diagnosis, these plans are not adequate for those types of diagnoses. There are safety nets built in, but essentially they're designed to eliminate the catastrophic, but it emphasizes first dollar benefits, preventive services, lab, well child, well adult types of care, eliminates all cost sharing, eliminates deductibles, eliminates co-insurance, co-payments even in most cases. So it's designed to give the average working blue collar hourly employee access to care. Now, that's a very significant difference. And most people that own property, own homes, have 401ks, do not want to carry the risk of having a dread disease diagnosis and losing everything. However, that mindset is different with the hourly service sector employee. They typically live from paycheck to paycheck. They don't own property. They don't have typically a lot of assets at stake. So their focus is a lot more on first dollar coverage. How do I access the doctor without having to come out of pocket with a lot? So these plans are designed for people that are living paycheck to paycheck and that really can't afford to go to the doctor if they got to pay $500 up front. So that's really the market focus here, is really on that, and that's why. And so the trade-off is the typical hourly employee. If you survey them, which we have, and ask them, would you rather have a $1 million, $5 million, $10 million plan that has a $500 or $1,000 deductible, or would you rather have one with no deductible that limits all of your coverage to $10,000? Well, overwhelmingly they said I'd rather have the first dollar benefit that pays $10,000. So we sell them what they want to buy, and we sell employers what their employees want, what their employees prefer, if you will.
Now we're talking with Bill Hammett here, and Bill had taken the time over the years to take all his intellectual property and put it inside of a book, and it's called Non-Traditional Health Plans: Everything You Need to Know About MEC and MVP and Hospital Identity Plans. One thing I want to point out, because I think people need to pick up this book, especially brokers, when you were talking about certain class or certain individuals are a good fit for it. And inside your book, you actually point out targeted markets, right? And so there are certain employee groups that this caters to. And you have construction in here, and janitor supply and landscaping, certain manufacturers, dry cleaners. And so there's obviously a huge niche related to this product that people desire and want and ask for. And is it possible that you could expand on some of those niches? Like, are they mostly regional? Are they national? What is your experience on some of those profiles of the companies?
The only limitation on it is they're certainly all national, and there's certainly many regional. These are typically not small, tiny employers, though. These are typically 50 to 100 or more, primarily hourly workers. We see that most employers that have executive or management will carve those out, and because of the lacks in the 105H, the fairness doctrine. Sure. Because of that, you're allowed to carve out. You're allowed to give preferential treatment, if you will, to management legally. And so they've taken advantage. A lot of these employers have taken advantage of that, offer a catastrophic or major medical type of plan for their management. But then they've got 150 hourly employees and some part-timers. They've got to comply with the Affordable Care Act. So what do? And so the niches that you mentioned are, the pretty traditional hourly employee kind of niches: landscapers, food services, hospitality, security guards, retail, all those, home health care or nursing home or assisted living. Those are all very typical. They represent probably, 8 to 12% of the entire marketplace, which is substantial. It's in the millions. Mm-hmm. As a consequence of those opportunities and driven by the Affordable Care Act, these employers were desperate to find something. None of them could afford a $400 or $500 premium, so they had to find something more affordable and still be in compliance. And that birthed the whole MEC, minimum essential coverage, MEC world. I can go into that a little bit. I don't want to get in the weeds with it, but essentially it's a derivative of plans that were limited benefit plans to begin with, that always served the hourly marketplace, and they just expanded. And under the Affordable Care Act, again, not to get in the weeds, but the act allows for you to only offer preventive services. Minimum essential coverage is essentially about 112 services that are all preventive in nature. If you self-fund those benefits and then offer them, you are in compliance with the large penalty under Obamacare, the so-called A penalty. That allows you to be in compliance, but in and of itself, it's not really a health plan. So most of the sponsors of these plans have incorporated what they call the plus or the jumbo parts, which are, they add insurance into it. So they combine the self-funded MEC plan with insurance for things like accident, lab work, emergency room, hospitalization to some limited degree, doctor's visits above and beyond the preventive. Those are all incorporated, and the package is called MEC Plus, MEC Heavy, various other names. I think the platforms that they're offered are worthy of a discussion. If we've got time, I'd like to share a little bit about there's 3 different types of platforms these plans go with. So, I don't want this to be a speech here, but I think it's important for brokers that are listening to this to understand that all of these are not created equal. There are 3 distinct packages that these come in, or platforms that they're offered from. The first is a carrier-sponsored single platform where the insurance carrier will devote all of their resources to administration, to marketing, to customer service, to underwriting, even reinsurance. If you find a carrier that does that, obviously the economies of scale are better, and there's a certain carriers that I have a preference for that have been doing this a long time, know what they're doing, and their economies are great. The second is you see what we call aggregators. They're just like you and I, Butch, could get together and put a private label name on a plan and call it a MEC Plus plan. We just have to go contract with a TPA. We got to contract with maybe a customer service outlet. We got to find a carrier, got to get paper for it. We put all that together and we sell it under our banner, the Butch and Bill Super Health Plan, right? And then the third category is, and far and away the most popular, if you will, or the most common, are TPAs, who have recognized that you self-fund the MEC benefit. Well, that's right up their alley. They're third-party administrators. So they design it, package it, private label it again, and sell it and sponsor it as a third-party administrator. The dirty little secret is TPAs can make a lot of money doing this, and their margins on normal TPA services are very narrow. But when you develop one of these plans, you can put fairly large margins in your pricing. You can charge $50, $60 for administration, for instance, whereas a carrier might only charge $5, right? So, economies of scale issues aside, I think the platform that offers all the comprehensive components of this, like a Pan American as an example, Pan American is really the innovators of the MEC plan. They invented the term, and first marketed it, and they have all those advantages I talked about. They own all those components, so they don't have to make a profit on all those different components. So the economies of scale are good. So anyway, sorry about the lengthy.
No, I think it's good for the audience. We do have brokers that listen to the podcast, so I think it was definitely much needed to dive into that a little bit. The larger companies you work with, has this been a tool has been used as a carve-out tool to help satisfy both maybe in-house executives versus the manufacturing floor, or whatever the carve-out might be? Is that doable, and is there anything to look out for that if somebody was looking at that angle?
Well, I mean, I'm a bit of a heretic. I get, people march after me with pitchforks and they want to run me out of town because I've had the audacity to mention that, you can take one of these plans, these MEC plus limited plans, and because the filing gap are so large, they can some of these carriers, Pan American example, can do a $250,000 a year hospital surgical benefit, which is a 99.5% of your employee population kind of thing. Mm-hmm. And what do you do about the 0.5% or the 1% or the unfortunate dread disease diagnosis? Well, there's critical illness packages you can put in there that'll give them lump sum to carry them through. There's no pre-existing condition limitations anymore. So somebody who finds an unfortunate diagnosis like that, there's safety nets for them. They can move into an exchange. They can buy private insurance. They can use this lump sum that there's built into the plans. So I believe that the time has arrived, and maybe my broker friends would disagree with me, but I think there are some plan designs that we can do within that structure that are rich enough where it satisfies almost everybody. And we go back to the days I mentioned earlier when I started 150 years ago, where employee benefit plans serve 95% of the group. When you do first dollar benefits, and that's your emphasis, it now does serve 95% of the group. And you're accommodating the other 4 or 5 or 3% who may have illness in their family or themselves. And you have to be able to give them a safety net. And I think there are safety nets that can be built in. So yes, to answer your question, I think there are some creative ways that we can use these plans, sure, not just for hourly workers, but sometimes for the executive carve-outs as well.
Hey gang, ever wonder what it's like to be a small business owner? It's confusing. Weird expenses coming out of nowhere. And when you throw in health insurance, forget it. Nobody understands how that works. If you own a business, big or small, it's one of the biggest expenses you have all year long. And yet, we all wait until open enrollment at the end of the year, and then we think to ourselves, next year I'll get a jump on it. And then it's another year of paying way too much. If you're a business owner, big or small, HR representative that wants to impress the boss, give Butch Zemar of Elite Benefits of America a call. Save yourself or your boss thousands or even tens of thousands of dollars a year. Reach out to Butch right now, 708-535-3006, or shoot him an email, butch@elitebenefits.net. And be sure to check out the Zemar podcast. Don't wait till the last minute. Put Butch Zemar to work for you now.
There's a couple penalties that are out there. There's one that's called A penalty and a B penalty. Right. Can you elaborate a little bit on this and where it would come into play?
Yeah, as part of the Affordable Care Act were penalties. Initially, there were 3. Some states still retain. One of them is the individual mandate, which you and I and everybody else are required to have, adequate health insurance. Otherwise, we pay a penalty. Individual mandate. Well, California has reintroduced that. Several other states have reintroduced that. Most everyone else, the penalty still exists, but there's no fine attached to it. So essentially, it's non-existent. Mm-hmm. But the two that most employers focus on are one, the so-called A penalty. It's 4980HA of the code, which prescribes a very significant penalty. It's substantial, and you don't want to pay it. It's not tax deductible. Mm-hmm. It's devastating if you have to pay the tax. So most employers have, some have, but most have complied because of the cost. The second penalty is the so-called B penalty, which the first one is essentially coverage directed, which is you have to have minimum essential coverage, which we talked about earlier. The second is that coverage has to be of minimum value, has to pass a minimum value test. If you offer and satisfy the A penalty, you're off the hook for that. But if you don't satisfy the B penalty, the minimum value penalty, then you're subject to a smaller smaller assessment. We call them penalties, but they're really just voluntary assessments. An employer can choose to pay the so-called B assessment or B penalty, which is around $360 per employee per month. Because it's so small and because it only gets triggered if an employee actually leaves your health plan, goes to one of the state or federal exchanges, and then in turn gets subsidized. If all of that happens, then you might have to pay an assessment of $360 something per employee per month. Well, my argument has always been that's less than what a major medical plan would cost. So, if you only have one or two employees that you get assessed that minimum value penalty, why offer the minimum value coverage? It doesn't make sense. It's more expensive to solve the problem than the problem. So, we've always said, look, we would recommend that you offer the A, comply with the A penalty, but not the B. And then in California, we have a different set of advisories which say all your employees are subject to that individual mandate there. So you have to, adjust your thinking that way as well. So anyway, those are the three major components of Obamacare, AKA Affordable Care Act, AKA whatever. Yep. And that's what employers are facing, mostly the A, the offering penalty.
And working with true experts or specialists in the field helps employers avoid some of those things and then have the products to cover it up to a point where they're compliant and their employees are happy. I just, in the interest of time, we'll start winding down a little bit, but I wanted to end on a fun note because I like to hear a little bit more about your football background, the legacy. And I know it sounds like you're heavily involved for many, many years. You've reffed. Talk about how you got into that and I guess what's your involvement today on it?
Well, first of all, the shortest story will be my career. That'll be the easiest one to get out of the way. I was just good enough to get a college scholarship and have my education paid for. And then I was just good enough to get cut from a professional team. So that's enough on that. On my, I'm far more involved with my alma mater, San Diego State University, with their, I'm the chairman of their Aztec Legacy Board, which is for the university. It's an athletic department, derivative, dotted line. We raise money for the football program, which, by the way, is Go Aztecs, 12 wins last year. Building a new stadium, brand new stadium on campus. All good news. And so, that's my involvement with those folks and great people out there.
Yeah. And you're heavily involved. You've been doing it for a long time. Now, are you still reffing games out there?
Yeah, and I'm still actively officiating high school football, which I've had for 30 years now, and keeps you young, keep getting to run around with kids. And as opposed to my profession, there are actually rules that you can enforce in high school football. In the business world, those rules tend to be a little more shaded and a little more nuanced, but. So I enjoy that part of it, being able to get out on Friday nights and do that.
Sure. I didn't know anything about this. There's a local ref here in the Chicago market that I connect with his wife, which is in the business world. He had talked about sometimes to get to even high school or even he's in the NFL now, but referees have to go through a long process. They get evaluated and they keep moving up. Is that true in California?
Oh, yeah.
Where evaluations keep occurring until
if you're a competitive to a fault like I am, it's a wonderful thing to be in because everything you do is merit based. You don't even get to work a high school varsity game unless you're good enough to move up to a high school varsity game. And then we have playoffs. Then we have state games and regional games, and the very best officials, the most highly reviewed. I know most people that don't officiate think they're all blind and don't know the rules, but believe it or not, there's some really good, talented officials, and the best ones get to work the better games. So and I'm a crew chief, which means I get to draft my own guys, and we work together a week, and we work to get better and minimize mistakes and review. We spend a lot of time reviewing film, and probably more time than I should. But it's a really fun. It was a little trying this year because I moved to Arizona, and we live up in the high altitude up here. And so I worked a lot of games in in 7,000 feet and 6,000 feet, which was a little different for, an old guy like me to be running around in that. But it's extremely rewarding. It's a great break from what I do here. So thanks for bringing that up.
Yeah, no, and it's a lot of good things, and obviously part of the program that you chair is giving back, and one of the things that's a lot of rewarding in anybody's career is the give back part. Yeah. And so I know you cater more towards the brokers, but if somebody wanted to elaborate on this conversation or get more information from you, or even figure out a way to get access to the book, how do they get in touch with you for any of that?
Okay, well, first of all, let me give you a brief commercial. I talk to brokers all the time, and the first thing they say to me is, well, I hardly ever run into these types of plans or run into these situations. And I said, great, that's why I exist, because, if you run into once or twice a year, that's all we ever have to talk. And so a couple things about my involvement. If a broker wants to talk to me, it costs them nothing. If they take my recommendations, it costs them nothing. It costs the employer nothing. There's no reflection in the premium. There's no reflection in the commissions a broker gets. I'm essentially a free resource. And hopefully I've demonstrated that I know what I'm talking about here. So I think it's worth the conversation. Secondly, I do focus primarily on the wholesale side of things. I'm a broker, a guy. I've got a couple direct clients, but those are only accommodations. I never want to compete with a broker. I never will. We're all on the same team, and I like to be the back room for them. Mm-hmm. So, the important thing is that, keep me on speed dial, because you're going to run into this. And, I have a website that is Hammett Insurance, or for Hammett Insurance, which has a lot of the stuff that's in that book. So if they don't want to go to the trouble to go through Amazon, it's available on Amazon under that title. You can either look up Hammett or the non-traditional health plan thing. Where's the camera here?
Yep. Well, I'll include some of these in the links in the show notes so that people can get access to it just with a quick link. Obviously, you were generous enough to send me a copy, and I appreciate
that. By the way,
that.
I will not make any money on the book. I will give you guys the price that's basically just covers the shipping and buying the book from or getting the book from Amazon. So I'm not trying to make any money on it, but it does put in there all of those ideas and concepts, and there's a lot of sales pointers in there. There's marketing, as you've seen it. Yep. There are pointers for new hires. We've got young people in our business that, how do I build my first block of business? Sure. There are pointers in there for how to do that, and I can work with you on it.
Definitely a great resource. I dove into it, made highlights in it. So definitely a great resource. Reach out or to be in the show notes. Definitely been great. I appreciate your time and the opportunity to go ahead and talk about the products and the markets you serve and a little bit of background on yourself. So I appreciate it. Maybe we'll have you back on for some updates as maybe current events keep changing things as we move forward.
Count on that.